Hi, I'm Dr. Harry Lawson. I'm the Chief Medical Officer for SIU Medicine, and today I'm joined by Cindy Womack. Cindy is an advanced practice registered nurse, or you may know the term nurse practitioner. And Cindy works in the Department of Neurology, specifically at the Center for Alzheimer's Disease and Related Disorders. So Cindy, welcome for joining me today.
Thank you. Thank you for inviting me.
We want to talk a little bit today about a special group of patients. Our patients that have Alzheimer's disease or related disorders, and certainly they have some specific challenges and also circumstances that we have to think about, whether they live in a facility or whether they're at home and they're getting a lot of additional help. So I thought maybe we would just start out with talking about in general how we are keeping in touch with our Alzheimer's patients and how we're seeing Alzheimer's patients right now.
Well, the most significant change is we've reduced the number of patients coming into the outpatient clinic. If we are still seeing patients on an urgent need, so those who have concerns and issues that may threaten patient safety. So those patients are still coming in. They will be seen, stopped at the door. They will have they'll have some questions to answer. They'll be asked to wear a mask. When they come into the clinic, they'll notice some changes in the physical layout where we're implementing the social distancing guidelines. Patients will, and their families will also notice that their provider will be wearing a mask, a face shield, and gloves. What they won't notice is the diligent work that's going on behind the scenes by our clinical staff as they disinfect exam rooms and that, to protect the patients, ourselves, and the community. The other thing that we're doing is we've embraced telehealth. We're doing many more telehealth visits. Those can be in the form of a phone call or audio visual connection, audio video, depending on what resources the patients and their families have. Our front staff is very good at explaining and helping the patients and their families with the options for telehealth. And those people who have used telehealth, in my experience, have been very pleased with that format. So those are a couple of things going on in the outpatient clinic. For patients at home, it's very difficult because they can't really social isolate. Many of those patients depend on other people for services like help with medications, personal care, meals, shopping, so it's very difficult in the home environment for them.
So it sounds like there's potentially some things that can do at home, kind of like what we do in our clinic to help. So if you have visitors or individuals who are coming in to assist at home, having them wear a mask, making sure that they're not currently having symptoms, right. Maybe asking if they've been exposed to somebody who's sick at home. All of those types of things might be good things for families to ask, or the support, system for that patient, to make sure that we're not bringing somebody in who might be ill. And that's kind of what we've done in our clinics. As you mentioned, we're still seeing patients in the clinic. We're seeing those individuals that we really need to see face to face, just to make sure that they're doing okay. And otherwise, we have the telehealth function, so we can do some distance type of visits. And as you mentioned, we are screening for symptoms at the door, asking questions. We are allowing for specific types of patients, like our Alzheimer's patients, a visitor or two, perhaps, that can come with that patient to make sure that they've got the assistance they need. And we're going to make sure everybody is safe and in a mask and not having symptoms. And it sounds like that would be similar types of things that people could do at home, to make sure that we're not bringing new exposures in or somebody who might be infected in.
We're recommending that our patients and families be proactive in this area. And just as you said, we recommend that they ask their outside caregivers what their health status has been. Do they have any symptoms of upper respiratory infection or other illness? That outside caregivers wear masks, that everyone in the home wash their hands, and wash their hands.
That's right.
And disinfect surfaces after the outside caregiver leaves. So that will help reduce the risk of transmitting any kind of infection to either the older adult or their family members.
You know, when we talk a little bit about maybe some individuals that we might actually bring into the clinic that we need to see them, what are some of the things, and obviously we're not going to list every single thing, but what are some of the types of things that might be going on that we would ask a patient to come in? Because I think families are probably a little bit curious about, well, why would we call to see if we need to come in? What would be going on maybe?
Well, for this population, a small percentage of them do develop behavioral neuropsychiatric symptoms of the disease, and we may need to see them in the clinic for that. So that may be hallucinations, delusions on the far end of the spectrum that we may need to see them in person, assess them, do a physical exam before we prescribe medication to help them. There may be other issues such as wandering, or we may be concerned that the patient has developed some other illness or medical problem, and we feel like we need to see them to determine what tests we might need to order.
So patients and their families still have the opportunity to call and sort of communicate what's going on. There might be an opportunity for a telehealth or virtual visit or phone call ahead of time to discuss all of these things. And then if there's certain things going on that are concerning, that we'll bring that patient in.
Yes.
And we're still doing that.
Yes, we are. We're still doing that.
Good, good. So sometimes patients are in a facility, not at home. Could be an extended care facility, or people call a nursing home. They might be in an assisted living situation. They might be in an independent living situation, or a group building or apartment that share common areas. And you know, depending on what stage of their disease or the Alzheimer's that they're in, they may be in one of those types of settings. What are some of the special recommendations we have, or special considerations that we ought to think about for those types of patients?
Well, this has been very difficult for our patients in residential care settings because of the quarantine conditions. So many of them felt much more isolated, and it's very difficult with the limitation of visitors for them to stay connected to their family members. And many of them, depending on how severe the illness is, may need assistance with using technology to connect to family. So what we're recommending to family are that the family communicate with the staff at the facility, ask for regular reports on your family member, make sure that your emergency contact information is up to date, including backup information. Talk with the staff and see if you can set up regular telephone calls with your family member. Many facilities are using the video conferencing technology such as Zoom, Skype, FaceTime. That helps patients. And one that we probably don't use as much anymore is write a letter to your family member. Send a card with a nice message. They can carry that around with them and refer to that. So those kind of things. We've all seen family members standing at windows trying to communicate with their family members, and you can do that as well. For most facilities will allow that. The other important consideration is that you need to talk with the staff at the facility, the administrator, and find out what their end-of-life policies are, because visitation can be restricted even at end of life, although some residential facilities are able to accommodate more than others. So that would be important to know, particularly if your family member is in hospice.
Okay, good to know. In the past, we've had some group settings, therapy settings, group sessions, could have family members also involved in those type of sessions. Are we currently doing those type of meetings now?
Well, we have beyond the medical center programs that are exercise, art, music programs, and even our early memory loss education and support group. We have suspended the group meetings because of the COVID-19 pandemic. However, we are exploring and testing video conferencing format for some of those programs, such as the Minds in Motion, which is cognitive stimulation and engagement, and also for the early memory loss education and support group meetings. We're exploring those. We can still do the music and memory program because much of that can be done over the telephone. So that is still ongoing.
Okay. How about our research? You know, obviously SIU has had a long history of research, especially around Alzheimer's, and that's been a program that's been here for a while. How are those things going right now?
Well, right now we have 5 clinical drug trials. Enrollment in those trials is suspended at this time. But the patients who are already enrolled continue to be seen, but we are following the CDC recommendations to keep them safe from exposure to the virus. There are Dr. Ala's caregiver study is ongoing, and we're staying in touch with those enrolled in that via telephone. There's other research going on that does not involve contact with patients, so that's progressing. The researchers in our science laboratories are continuing their state and federally funded research projects. Those projects are aimed at identifying novel biomarkers to identify the disease earlier, and also looking at potential treatments for the disease.
And obviously during this time things have slowed down a bit, but we're certainly continuing to do the things that we had been prior to COVID, other than enrolling new patients and perhaps seeing folks face to face. But as soon as we can, as soon as we get that guidance from the Centers for Disease Control and the Illinois Department of Public Health, and we understand how our community is responding to the current issues, we'll get those research activities up and running again. But that's good to know that the existing program is still functioning in the background, even though we're bringing in new patients at this time. So that's a good thing to know.
And our team is working very hard to stay connected to our patients and their caregivers. We are available via telephone if they have particular issues. We can continue to refer them to support services in the community and connect them with services that they may need. So that's ongoing. That hasn't changed.
Okay. I think we've gone through a lot of our questions that we had prepared. Are there any particular things or key messages that would be important for our patients, our community to understand for Alzheimer patients?
I think that the isolation that has to occur because of the pandemic conditions is very difficult on this patient population. We need to think about that in our interactions and try to find creative ways to reach out and connect with the patients and even the caregivers. This can be very stressful for the caregivers, and we all know the negative consequences on stress for caregivers. For patients and families that are at home, I would say it's very important to maintain your daily routine because that acts as an anchor for the patient. It helps keep them grounded. Also, eating a healthy diet, regular exercise, trying to maintain the normal sleep-wake cycle is also important for the patients. And having social activities that resonate with the patient. Music is a wonderful way to calm people down, help them remain relaxed. Looking at picture books that may resonate with the patients. Depending on the severity of illness, there are many other things that can be done to help alleviate anxiety and help the patient.
Great. Those are really great points, and so hopefully people can use that information and again maintain all of those sort of normal functions, environment, everything that the patient has become used to. They have the ability to call SIU, talk to a provider, even do a virtual visit to determine if they need to be seen. So we're still doing all of those things. So that's really great. I really appreciate you being here with us today. And I think this is really important information for our patients and their families to really understand this and hopefully be reassured by this. So we thank everyone for watching our video today, and as always, stay well, stay apart, and wash your hands. Thank you.